Welcome to the CBP Cervical Rehab Seminar. We're going to go till 7 o'clock tonight. I hope everybody got that on their schedule. Tonight's a long day. I'm going to pack you full of information on the structure, function, and then structural rehabilitation of the cervical spine and posture. We'll do a little bit with the thoracic spine as well. We will not discuss much on the low back except one or two studies that might relate the cervical spine to the lumbar spine. That's it. So lumbar questions that might come up, I'll defer you to two sources. Number one, a book. Number two, guess what? The lumbar seminar, or another book that may not be written yet. That happens occasionally. Who's brand new this weekend with us to a CBP seminar? Okay, that's good. You're in for a little bit of fun, a little bit of a ride. We tend to pack a lot of information into this particular conference. We will do a tiny bit of adjusting at a station, but the purpose of this conference is not to learn how to adjust the cervical spine. The purpose is to learn our exercise and traction rehabilitative methods for the structure of the spine. Okay, so keep that in mind. The adjusting session is very limited. We have a full conference on how we do adjusting. Actually, we have two of them. So hopefully you understand that and understood that before you got into this. Any students in the room? Chiropractic students. Great, thank you. Where are you from? Kansas. All right. We don't have the elective going there, but we're working on it. I'll have a slide on the elective classes that we have and the core curriculum classes that we have, and they're growing. We'll try to get Kansas City back online. We'll see. But we appreciate the students being here. Doctors that have been to this seminar before, raise your hand, please. You'll look around, you'll see several people have been here before, and if you're brand new, you'll go, why, why would they do such a thing? Well, you'll see why. When we get through the material, you'll go, there's no way that you're going to learn this material in one seminar. It's just not going to happen. Number one, new material has to not only be processed, it has to be practiced. You have to go back and you have to implement the procedures that you feel comfortable with into your practice. Then you get good at those. You learn when they apply, when they don't apply. Then you're ready to attend the seminar again and learn the material that you didn't pick up on. Occasionally, I have had people that have taken this course 5, 6, 7 times, and each time they tell me they learned something new. Part of that is because there is a lot of material. The other part is we always update things and add new things when we find out that what we were doing wasn't working. Okay? That's what we do as clinicians, I hope. That's what we do as educators, and that's what I do as a researcher. You test your procedures, and if they don't work, you don't keep doing them, you try something else, yes? And unfortunately, that doesn't happen a lot in science today. Unfortunately, what happens is we keep doing the same stuff and we blame it on the data, right? Right? Continuing to do the same procedures is kind of like, I don't know what you'd call it, but I would call it clinically incompetent from my perspective. If you found out through studies it didn't do what you said it was going to do, instead of blaming the science and the research, you need to kind of change your methods and update what you're doing. First hour and a half with me. Introduction to this particular course, introduction to the topics that we'll be going through. Basically, it's to try to get everybody on the same page with structural rehabilitation as a scientific goal and a technique goal. So we do a lot of studies in the first hour and a half. After that, much more clinical in terms of what we're looking at on X-ray, postural patterns on X-ray, curve patterns on X-ray, and then we dive into the rehabilitation methods. Okay? At the end of tonight, we break into small groups and we train on the various equipment that you see here. We'll have one adjusting station, but mostly we'll have these traction unit stations. Okay, we'll do that from 4 to 6 o'clock. And then from 6 to 7, because it's late, I always bring in some booze for you to get you relaxed. If you don't drink, fine. Laugh at the people that do. And then I'll give you a presentation that's also clinically relevant, but it'll be kind of casual over a couple glasses of wine. I hope you're into that. But it is part of the CE hours. I just break the rules and get you drunk while we're doing it. For Sunday, we'd go through some, I appreciate the humor. Occasionally my humor's a little dry, and it misses people. That's okay. For Sunday, what we're going to be doing is case analysis, case management, more traction, and then some research studies if we get to them. And we'll also throw in some clinical relevancy. CBP seminar certification. How many in the room are certified, basic certified at least? Raise your hand. Okay, so we've got a handful of people. Advanced certified doctors, raise your hand. Yeah, you just need to submit me your case is all you need to do, Stephen. So advanced certification, it used to be 12 courses, but now we're starting for 2012. It's 14 courses. We always did the courses, we just made 2 of them optional. We're now going to make you jump through 2 more hoops because we think it's relevant. There's more information every day on the spine, and it's very difficult to fit it into 12 courses. I want you to know that. So what we've done for our advanced training, we now have 14 courses. If you've already started the process, I'll go ahead and grandfather you into the 12, but you should eventually take the other 2. I'm not going to force that on you. I don't want you to think of it as a monetary thing. We want it to be an educational thing, okay? The slides up here, what I did is I took one of the courses out of the advanced course and I threw it into here. There's 6 courses. X-ray and posture, spine model, drop table adjusting as the focus, instrument adjusting, upper cervical as the focus. You're at number 4. We have a similar one for the lumbar, and then we have this hands-on workshop training where we see if you can implement all that into a case analysis setting in a small group. I took an advanced course and put it into here. I just want you to guess which one. If you've been to CBP, which one? Yeah, that makes sense, right? People would do these and then they wouldn't take the advanced courses, the thoracic rehab, and then they'd say, well, I'm having difficulty with certain necks and they're not responding to what I'm doing with the cervical spine procedures. And I would say to them, well, that's because you're missing the thoracic spine. And they'd say, well, what do you mean? I'd say, come to the thoracic rehab seminar. And they'd say, I don't want to. And I'd say, well, buy the thoracic rehab book. What's the problem with that? It's not written yet. It's only in a conference. If some of you don't know me yet, you don't know my little humor. My father passed away this summer, and we were a great team. We were not just father and son, we were best friends. We worked together for 12 years. What I would do to him is all the new material I would develop with other doctors, and I would put it in a seminar, and he'd say, we need a book. And I'd say, yeah, I'm working on it. Well, I'd be working on it for years. And so what he'd do is he'd finally get tired of that, and he'd advertise in our journal, new CBP lumbar book available now. For contact information, he'd put my personal phone number and my email, and then he'd send that out to 60,000 chiropractors. And then I'd get these calls, and I'd say, where is this coming from? I mean, literally, I'd get 100 calls. And then I'd know that my dad put an ad in the journal to contact me for the new book, and that was his way of saying, can you get the book done? I'm working on the thoracic book. It's not done yet. We're working on it. We have a great start. It should be available next year. Okay, hopefully in the spring of next year. But right now, it's in the thoracic rehab seminar. There are things in the thoracic spine that will affect the cervical spine to where if you do not address the thoracic component, you will not correct the cervical spine. That makes intuitive logical sense, but it's often overlooked. Okay, I will show a few things here this weekend, but not in enough detail to where you'd probably feel comfortable with it. Advanced courses. The thoracic seminar went up there to the basic one. So what we did is we replaced it with a couple. We have a whiplash trauma injury conference where we talk about complex ligament injuries in the cervical spine, mostly in the cervical spine. We present information on MR imaging and advanced imaging and what to look for in terms of alar ligament damage, tectorial membrane damage, PAO membrane damage, etc. Anybody was at the annual seminar this past September? Anybody there? Some of that material was presented there with Dr. Chintan Desai, the MD radiologist. Pretty cool stuff, right? Well, we have a whole course on what we're doing with that, how we analyze it, how we rehabilitate those patients. And then what we did is we asked you to take the CBP annual as well. That's the advanced course series. Today, the problem is, if you want to be certified in a technique by general chiropractic consensus, it's not quite law, but it's close, you need to have certification tests. So they actually require that. I've been contacted by boards to send the tests, or at least the outcome of the test, for CBP certified doctors. They are actually requesting that groups like myself do certification programs. We have a test. The first program, the basic program, has a formal test. This one doesn't have a test. You'll see at the bottom, it's a case report, which is probably better than a test. It's to see, do you do CBP technique in your practice, and are you good at it, right? And maybe it's a failed case, which is fine. Failed cases are important to document. We tried this, it didn't work, okay? But some kind of case report where you approached the management intervention with CBP methods. You've got to show me what you did, you've got to show me the outcomes, you got to show me the equipment that you have in your practice. A CBP doctor's office should have the equipment that you see in here. It should not just have an adjusting bench. That's not the way it works. We have rehabilitative procedures. Okay, so if I refer a patient to you, I expect, if you're listed on my website as certified, I expect that you have this equipment. Is that fair? Yes? And I refer patients every week through my office, actually every day almost, and I personally refer patients from around the world, depending on where I'm flying to. I actually just met somebody from London a couple flights ago, and I sent them to a CBP doctor in the UK. It's pretty cool now. You can look up really quick on GoGo internet, just boom, go to cbppatient.com, and I can find a practitioner anywhere in the world if I have one there. How many of you use that website? Okay, CBP doctors use the website to refer to other CBP doctors. So the certification program not only is it an intellectual process to see if you do CBP, it's also beneficial for you from a consumer point of view. Patients will use that site to locate CBP doctors. Cool? The case report, we want to publish the good ones. We want to see if we can help to change the direction of our profession through good quality case reports. Okay? I think that's an admirable goal. A case report oftentimes is looked at as low quality research. It should not be. A collection of case reports on the same condition using the same methods has been shown to be equivalent to the randomized clinical control trial. Did you know that? Anybody? That's the way it is. A case collection of similar conditions with similar people that have that same kind of condition, if we treat them in the same manner, the outcomes of that are equivalent to randomized clinical control trials. It can't be one case, it has to be multiple cases. So let's say 30 doctors chose to do their case report on cervical kyphosis with migraine headaches in females between the ages of 25 and 40 years of age. Fair enough? And you kept good records, you intervened the same, it was chronic conditions, etc. What we would see in that population of cases would be very similar to a randomized trial on the same population. Okay, so that's part of our goal. The other thing is a lot of doctors would like a case report in the literature. How many of you would like at least one publication after your name or that you did in the literature? Yeah? Some yes, some no. So this is the way we help you. We have a team of people that do that. Some of them are in the room, and I'm really the kind of the general supervisor of that. Jason Yeager, can you see if you can dim these front lights on the screen? Because when I show some x-rays, that'd be awesome. The first introductory few slides are just not just killing time. It's kind of answering some questions, but it is killing time because you'll notice the room's filling up. Have you noticed that? I always notice that after 15 to 20 minutes, somebody should be on time, but they never are. I don't give tardies, but what I do is I go slow in the first 15, 20 minutes so the room fills up. Just an FYI. CBP, Structural Rehab of the Cervical Spine. It's our book that follows this course. It's a great textbook. The problem is this book was written in 2001, 2002. It's now 10 years later, so there's a few things that may not be what? He's just playing. Just see if you can dim just the front lights. Can you do that? Is that possible? You know, we're split this room down by section, so it's either left or right. Is that what it is? Is that what you're telling me? Okay. Is that okay, Charles? It's going to have to be. Can you make it work? Thank you. Can you go one more up, Jason? Just see if you can get one more up. Okay, so there's a few things that aren't in the book. So what we did is we have DVDs that are a little more contemporary, and then we have notes. The bummer with you guys today, and this is the problem with this time of year for me, usually we give a CD to everybody. Nobody has a CD in their folder this time. You know why that is?
You haven't made it yet? You forgot.
I forgot about it. It's hunting season. And what happened was I forgot to update the notes in time and get them to Joe Ferrantelli. And when I did, he said, Deed, I'm out of town. I told you I was going out of town. So I'm going to have to email everybody the notes, okay? So you got to make sure that we have your personal email. A lot of times you think we're going to spam you, and so you give us your reception's email. Well, your receptionist will delete that email probably. So please make sure with Holly out front that we have your email, and I will email everybody a link to download the PDF file of the notes, okay? So you will get all the slides that I'm going to show unless they're directly out of my textbook. If they're directly out of the textbook, I don't give it to you on the note, okay? But all the research stuff you don't have to write down, it's on the note CD. My apologies, I lose track of myself during this time of year. It's my personal holiday. I take 3 weeks and go in the mountains. You learn a lot about yourself, not just about CBP, you learn a lot about yourself. Like when a bear comes into your tent at 2 in the morning and you're sleeping, are you the type of person that stays in the tent? Or are you the type of person that gets out of the tent first